Hello, my name is Randiga Harnes. I have been a student of the Genomics Research Advocacy course, um, and we have gone through about 6 topics in the past um, few weeks. So, introduction to policy advocacy. We have learned a little bit about what policy advocacy is, who are the people engaged in the policy making process, uh, how to reach out, why it's necessary, and basically, if everything is supposed to be forgotten and one thing to be gone away with, or one thing to be taken away with, is that resources are not just given, they have to be fought for, they have to be advocated for. So, current policies and regulations around the world, the regulations per the Nuremberg, but the different laws that are around the world when it comes to genetics and genetic information and research. These advocacy strategies where we learned how best to engage stakeholders to make sure that we have results that we need. But the policy development process, we also looked at the ethical considerations in policy making. And then we also looked at case studies in policy advocacy. So basically, my key takeaways from the entire course, and I suggest that everyone enroll for this course if you get the opportunity, that we need evidence-based advocacy. Advocacy has to be done by evidence, and evidence is only gotten through research. So you have to put effort on both sides on research and now allowing us to get the data, the information, the knowledge that we need concerning what it is we are advocating for, and in this case, is genomics. So, why is genomics important, for example? And we use that evidence to talk to stakeholders, many of whom are not experts in health or healthcare or even genetics for that matter. There's need for collaboration. We live in a setting in Africa, for example, where there's a lack of expertise, I would say, and the little expertise that we have can be best used if every professional comes uh, with their ideas, with their skills into a pool so that we are able to move together as one. Communication needs to be clear when engaging stakeholders. For example, it is very important that we use clear and concise language that is simple to understand, language that can be used um, plainly and simply to get across the information, the message that we want to get across. There's need for advocacy, for ethical advocacy. And again, evidence based advocacy, I think, comes into this because we're not lying. We're not supposed to lie. We're not supposed to we're supposed to make sure that no one is getting harmed in the process. We're supposed to make sure that justice is being served and benefit to society is primary and paramount. So, my personal view about this thing, about this entire project that the Pan African Postgraduate Studies Education Research Initiative is doing, or PAPERI is doing, is that at this moment we live in a very tricky time. We have funding cuts, and our traditional donors are becoming more and more protectionist. And Africa, for that matter, now has to stand and has to create its own initiatives to make sure that we are not left behind when it comes to genomics research. There's a wide need for genomics research. And even as Africa is experiencing an epidemiological shift, that is, we are seeing an increased standard of living for our population. That means that infections are reduced, infectious diseases are reducing, but we're having non-communicable diseases on the rise. Genomics is going to be very important as a field and as a tool to make sure that we are able to protect our population, is able to treat them in time before we to rescue them from death. That is, which is the worst outcome, especially premature death. Um, so thank you for the organizers. I think it's been a good fun days, and thank you for the grace that I have had so far. It's not easy juggling duties, but it's been an interesting thing so far. Thank you.